I'm Dr. Stephen Davidson, the Sexual Integrity Coach located in Wilton Manors, Florida. Welcome to another episode of Adult Sex Education. You might be wondering why a sex therapist is talking about domestic violence. When clients seek help for sexual problems, it's important to understand the big picture. You've heard me say many times that human sexuality is complex, and sexual dysfunction can result from problems that are physical, psychological, cultural, or relational in nature. Male sexual disorders such as erectile dysfunction, anorgasmia, or early or delayed ejaculation are often the consequence of performance anxiety. It's important to understand why he is so anxious about something that should be bringing him pleasure. Deep questioning about his sexual relationship sometimes reveals that he is a victim of abuse perpetrated by an intimate partner. When you hear the phrases domestic violence or intimate partner abuse, you likely think of battered wives or girlfriends who are physically and sexually assaulted by men who demonstrate what's often referred to as toxic male behavior. You rarely hear stories about male survivors of domestic violence, and when you do, it's often followed by a comment like, "He probably deserved it," or "He likely had it coming." Male victims of domestic violence, rape, or any other form of abuse or assault receive far less compassion or even respect than those cases where the victim is female. It's important to acknowledge that today, as different from 30 years ago, commonly referenced definitions of domestic violence make no distinction between male or female victims. Violence can happen in a variety of relationships regardless of gender, marital status, or sexual orientation. The battered wife persona never captured the whole story. Domestic violence is a pattern of behaviors used by one partner over another to maintain power and control. This can include intimidation, social isolation, coercion and threats, financial abuse, verbal, sexual, or emotional abuse, as well as physical violence or assault. Perpetrators and victims can be straight, gay, male, female, or trans. Rarely does a man come to therapy claiming he's being abused by the woman in his life. A therapist usually discovers this when the man talks about the dynamics in his relationship. Men are so socialized to minimize emotional or physical pain that they often don't consider that they deserve better from a partner. From childhood to adulthood, males get little sympathy for the physical, sexual, and emotional attacks they receive from women or other men. Many male survivors don't report abuse or assault because they've been socialized to believe men are more disposable than women, and being knocked around physically or emotionally is just part of taking it like a man. We often hear about the social disparities between men and women in our culture, but did you know that 77% of homicide victims are male? Men are almost 4 times more likely to die from suicide than women. Every 20 minutes, another man in this country kills himself. Infant mortality is 21% higher for infant males than infant females. 75% of homeless people are male. 1 in 6 men are victims of sexual abuse. Men are more likely than women to die before the age of 65, and they are 2 to 3 times more likely than women to die a violent death. Intimate partner abuse is just one more way men experience adversity that gets minimized or dismissed as socially irrelevant. When the brain is preoccupied with thoughts that generate emotions of fear, guilt, shame, or sadness, the brain's priority is to relieve the distress. This is part of our innate survival mechanism that is always on autopilot in the back of our mind. Before engaging in sexual activity, the brain automatically wants to eliminate the source of distress. The primitive brain doesn't differentiate between physical or conceptual threats. The cortex, often referred to as the executive brain, wants to bring logic and reason to the problem-solving process. Men will try to think themselves into erections or ejaculation as a way to deal with the sexual dysfunction. But erections and ejaculations are not generated through executive brain functioning. The unconscious mind knows the unfortunate truth that the conscious mind is trying to deny. Men generally don't understand how their emotions affect their sex drive and functioning. Men are often unable to recognize when they are anxious because men are also socialized to deny fear. When he can't perform sexually in this relationship, the abusive partner will likely respond with judgment and accusations, escalating the conflict further and reinforcing the sexual dysfunction. Men are quick to downplay the abuse as a relevant factor in their sexual dysfunction. Men believe many of the same sexual myths as women. Like women, men think that a man should always be ready for sex anytime, anywhere, and under any circumstance. Men fear that they are less of a man if they're not always ready, willing, and able to perform sexually. He has become so disconnected from his emotions that he can't see the correlation between the sexual functioning and the dysfunction of this abusive relationship. Digging deeper with him, one often discovers a long history of unhinged behavior from his wife or girlfriend that he has been tolerating for years, or even multiple relationships with different abusive partners in his lifetime. Early in the relationship, the abuse may be unrelated to his sexual performance, but over time, the emotional battering he experiences in this relationship will unconsciously render his partner less and less sexually desirable. His innate survival instinct shuts down his erotic desire for her as a means to repel him from the physical and emotional threat of this relationship. A confident, emotionally healthy man will leave a relationship where he's being abused. A man whose self-esteem is already precarious will blame himself for how his partner is treating him, believing that if he could just perform to meet her demands, the abuse will surely end. Here are some statistics that might surprise you. 1 in 19 adult men have been stalked by an intimate partner. 1 in 14 men have experienced sexual violence perpetrated by an intimate partner. 50% of adult men have experienced psychological abuse perpetrated by an intimate partner. 1 in 7 adult men have experienced severe physical assault by an intimate partner at some point in their lifetime. Male survivors of domestic violence are less likely than women to report to authorities when they have experienced assault or abuse, mostly because they fear they will not be believed. They fear they will be blamed for the attack, and they fear they will be shamed as men for being a victim of an assault. They don't believe the legal system will take them seriously. Male survivors of intimate partner abuse have been referred to as the invisible victims because they rarely disclose what is happening and others rarely intervene to help them. Here are some common ways men experience domestic violence. Number 1, physical abuse, such as slapping, biting, punching, kicking, scratching, throwing objects at him or hitting him with objects, intentionally pouring hot or cold beverages on him or throwing them into his face, and of course, more severe abuse, such as stabbing, shooting, or choking. Number 2, threats. Threats to harm his pets or children, threats to turn his children against him, or threats to deny him access to visitation or contact with his children. Threats to share personal information with coworkers or family members. Threats to lie to coworkers or family, or even the police with fabrications about his sexual behavior or allegations of abuse. Number 3, financial abuse, such as stealing money from him, not paying bills, charging up his credit cards, or sabotaging his employment. Number 4, verbal abuse and shaming, such as name-calling, challenging his manhood, degrading him about his physical appearance or sexual performance. Number 5, emotional abuse, such as gaslighting, manipulation, and coercion. This also includes threats of suicide if he doesn't follow her demands, public shaming by posting personal information on social media, or posting false information on social media as a way to harm his reputation and isolate him from friends and family. Number 6, sexual abuse by forcing or demanding sexual activity without his consent. Number 7, stalking him in person or on social media as a means of intimidation and fear. Number 8. Gender privilege. Playing the vulnerable, helpless female card to gain empathy or advocacy from others when he attempts to defend himself, set boundaries, or hold her accountable for her actions. Domestic violence comes in many different forms, and some of them are more severe than others. Some are even fatal. It's important to not assume that domestic violence only means physical violence. It's important to not diminish the emotional and psychological consequences of any form of abuse toward another individual, regardless of their gender. All couples have conflict. In times of anger, most of us have said or done something that we regret. We later apologize for it, and we never repeat it again. It is possible to express anger without name-calling, shaming, threatening, or assaulting the other person. No one likes having conflict in their relationship, but you should never have to fear for your physical, emotional, or financial safety when your partner is angry at you. With domestic violence, there is often a pattern that is repeated within the relationship and repeated in all other intimate relationships that the perpetrator is in. Most therapist and domestic violence programs reference the power and control wheel when defining and clarifying types of domestic violence. The power and control wheel was created in 1984 as a result of research in Duluth, Minnesota, on female survivors of domestic violence perpetrated by men. It has been translated into 40 languages around the world and is the most commonly used model for understanding domestic violence. However, as good as it is, its choice of pronouns has contributed to the misconception that when it comes to domestic violence, women can only be victims and men can only be perpetrators. By simply removing the pronouns, this same tool created over 35 years ago still has relevance today. The same concept can be communicated in a way that is human-friendly, without blaming one gender specifically, and without discussing intimate partner violence as if cisgender straight women are the only victims. The law is gender-neutral on the subject of intimate partner violence. Women can also be arrested for stalking and domestic violence and incarcerated or court-ordered to treatment. Men make up approximately 15% of reported cases of intimate partner abuse, and men are increasingly coming forward reporting the women who perpetrate violence against them. Finding resources for male survivors of intimate partner abuse isn't easy. Most shelters are designed for women and children only. However, men, you might want to check out the website at malesurvivor.org. If you are a male survivor looking for a therapist, be sure that the therapist has experience treating male survivors. Sadly, most therapists are trained to focus on advocating for women and children only, and may be culturally biased against helping men who are victims of intimate partner abuse. If you or someone you know is a victim of domestic violence, whether male, female, or trans, I recommend calling the National Domestic Violence Hotline at 800-799-SAFE. That's 800-799-SAFE. Or visit their website at thehotline.org. I'm Dr. Stephen Davidson, the Sexual Integrity Coach located in Wilton Manors, Florida. I hope you will like this video and subscribe to this channel. Please check out my website at sexualintegritycoach.com to learn more about the services I provide, as well as get links to both of my books, Sexual Integrity, Finding the Courage to Be Yourself, as well as Peaceful Mind, Peaceful Life, the guidebook to happiness.